At the GHA public meeting this week, consultant oncologist Dr. David Ballesteros Quintanilla, who leads the cancer unit, gave an overview of the disease on the rock, including the major risk factors.
Thanks to the Gibraltar survey outcomes, we find out that our population have extra weight, and a third of them, they drink alcohol, a quarter smoke, and another quarter they do very little exercise. So all of these creates additional pressure in the future for cancer.
Dr. Ballesteros said while pollution can cause cancer, smoking is by far the biggest danger, and that this needs to be tackled.
The numbers that we produce, thanks to this database, is that we confirm that 60% of our patients have been smokers, and about 60% have an extra weight. 54 are female, 39 are senior, more than 70, and up to a third they have a family history of cancer.
The consultant oncologist cited a study showing that 1 in 2 people will develop some form of cancer during their lifetime.
The numbers that we are seeing is, in the last 2 years, this is the top 7 types of cancer that we see at the cancer unit, which is breast number 1, lung number 2, colorectal number 3, urology, which mainly includes prostate and bladder, gynae, which includes ovary and endometrium, upper GI, which includes pancreas, esophagus, stomach, and melanoma.
Dr. Ballesteros also looked at solutions and targets, including more staff, such as a coordinator, a new consultant specialized in breast and gynecological cancer, and a psychologist for vulnerable patients. And he highlighted the importance of prevention.
But prevention is also an important aspect in the care in cancer, with a radical upgrade in prevention, vaccination, and obesity. Reinforce the cancer screening is a must, especially with bowel, breast, and cervical cancer. There's new initiatives in the UK for lung health checks in patients who are smokers and they might have a CT scan, but they're all initiatives that should help us to reduce our cancer figures.
On the planned new and bigger cancer unit, GHA Director General Professor Patrick Gagan said this was a priority in the GHA's budget for this year, which is currently being negotiated. He said he was confident there would be a brand new and fit-for-purpose unit next year.
If you could make a wish list as an oncologist, probably this is the closest in terms of a cancer unit, a new cancer unit, and we are working to get funding for this. And also extra support in staff, but also to reinforce the palliative care strategy with the GHA and cancer relief.
You can watch the full talk by Dr. David Ballesteros Quintanilla on Friday evening at 7:30 on GBC television.